হ্যালো এভরিওয়ান। তো প্রত্যেক দিনের মতো আজকেও আমি কিছু মাল্টিপল চয়েস কোশ্চেন নিয়ে আপনাদের সবার সঙ্গে আলোচনা করব। তো এই কোশ্চেনগুলো রয়েছে মাল্টিপল চয়েস কোশ্চেন, যেইগুলো আমাদের স্টাফ নার্স গ্রেড 2 এর জন্য খুবই ইম্পর্টেন্ট, আর আমি কিছু ইম্পর্টেন্ট কোশ্চেন নিয়ে আলোচনা করব। এই কোশ্চেনগুলো রয়েছে অবস্ট্রিক অ্যান্ড গাইনোকোলজিক্যাল নার্সিংয়ের ওপরে। তো বেশি দেরি না করে চলো তাড়াতাড়ি কোশ্চেনগুলো নিয়ে আলোচনা করা যাক। So the first question is, the length of the fallopian tube ranges from option A 22 to 27 cm, option B 7 to 12 cm, option C 28 to 31 cm, and option D 2 to 7 cm. Length of the fallopian tube, and the correct answer is option B 7 to 12 cm. And the next question is, PEG cells are seen in the option A intestine, option B fallopian tubes, option C stomach, and option D vagina. PEG cells are seen in the, and the correct answer is option B fallopian tubes. And the next important question is, the most common anatomical position of the uterus is. Once again, the most common anatomical position of the uterus is option A anteverted and anteflexed, option B retroverted and retroflexed, option C retroverted and anteflexed, and option D anteverted and retroflexed. And the correct answer is option A anteverted and anteflexed. And the next question is, the lower uterine segment is formed from the option A cervix, option B isthmus and cervix, option C body of the uterus, and option D isthmus. And the correct answer is option B isthmus and cervix. And the next important question is, structures that support the uterus include option A round ligament, option B boat ligament, option C cervico-vaginal junction, and option D all of this. And the correct option is option D all of this. And the next important question is, the shape of non-pregnant uterus is. Once again, the shape of non-pregnant uterus is option A globular, option B pear-shaped, option C oval, and option D cylindrical. And the correct option is option B pear-shaped. The shape of non-pregnant uterus is pear-shaped. And the next important question is, blood supply to the uterus is by. Once again, blood supply to the uterus is by option A ovarian artery, option B uterine artery, option C both A and B, option D none of this. And the correct option is option B uterine artery. And the next question is, the origin of the ovaries is from. The origin of the ovaries is from option A genital ridge, option B genital tubercle, option D Wolffian duct, and option D Mullerian duct. And the correct answer is option A, genital reeds. And the next question is, ovarian artery is a branch of. Once again, ovarian artery is a branch of. Option A, renal artery. Option B, internal iliac artery. Option C, abdominal part of the aorta. And option D, external iliac artery. And the correct answer is option C, abdominal part of the aorta. And the next important question is, the normal length of the uterine cavity is usually. Once again, the normal length of the uterine cavity is usually. Option A, 5.5 to 6 centimeter. Option B, 6.5 to 7 centimeter. Option C, 7.5 to 8 centimeter. And option D, 8.5 to 9 centimeter. And the correct answer is option C, 7.5 to 8 centimeter. The normal length of the uterine cavity is usually 7.5 to 8 centimeter. And the next question is, largest cell in the human body is. Option A, myelin cell. Option B, glial cell. Option C, osteocyte. And option D, ovum. And the correct option is option D, ovum. Largest cell in the human body is ovum. And the next important question is, a vaginal fistula that opens into the rectum is called. Once again, a vaginal fistula that opens into the rectum is called. Option A, rectovaginal fistula. Option B, enterovaginal fistula. Option C, vesicovaginal fistula. And option D, colovaginal fistula. And the correct answer is rectovaginal fistula. A vaginal fistula that opens in the rectum is called rectovaginal fistula. And the next important question is, a procedure that allows the physician to examine the lining of the bladder is called. Once again, a procedure that allows the physician to examine the lining of the bladder is called. Option A, colposcopy. Option B, uteroscopy. Option D, uteroscopy. And option D, cystoscopy. And the correct answer is cystoscopy. A procedure that allows the physician to examine the lining of the bladder is called cystoscopy. And the next question is, inflammation of the fallopian tube is. Once again, inflammation of the fallopian tube is. Option A, endometritis. Option B, vaginitis. Option C, cervicitis. And option D, salpingitis. And the correct answer is salpingititis. Inflammation of the fallopian tube is salpingitis. And the next question is, at term, uterus weight is. Once again, at term, uterus weight is. Option A, 200 to 300 gram. Option B, 400 to 500 gram. Option C, 600 to 700 gram. And option D, 900 to 1000 gram. And the correct option is option D, 900 to 1000 gram. At term, uterus weight is 900 to 1000 gram. And the next question is, pacemaker of uterine contraction is situated in the region of the tubal ostia, B, SA node, C, AV node, and D, Purkinje fibers. And the correct option is option A, tubal ostia. Pacemaker of uterine contraction is situated in the region of the tubal ostia. And the next important question is, which among of the following is an age-related changes that occurs in female reproductive system? Once again, which among of the following is an age-related change that occurs in female reproductive system? Option A, sore nipple. Option B, vaginal dryness. Option C, decreased risk of vaginal yeast infection. And option D, increased level of estrogen. And the correct option is option B, vaginal dryness. And the next question is, breast is composed of. Once again, breast is composed of. Option A, glandular tissue only. Option B, connective tissue only. Option C, connective and fatty tissue. Once again, breast is composed of. Option A, glandular tissue only. Option B, connective tissue only. Option C, connective and fatty tissue. Option D, glandular and fatty tissue. And the correct answer is option D, glandular and fatty tissue. Breast is composed of glandular and fatty tissue. And the next question is, breast is the modification of which gland? Breast is the modification of which gland? Option A, sebaceous gland. Option B, endocrine gland. Option C, Bartholin's gland. And option D, sweet gland. And the correct answer is sweet gland. Breast is the modification of sweet gland. And the next question is, the skin of the breast is thickest at option A, superior aspect. Option B, lateral aspect. Option C, areola and nipple. Option D, base. And the correct option is option D, base. The skin of the breast is thickest at base. And the next question is, milk production takes place in which part of the breast? Once again, milk production takes place in which part of the breast? Option A, lobes. Option B, lobules. Option C, mammary duct. And option D, nipple. And the correct answer is option B, lobules. Milk production takes place in the lobule part of the breast. And the next question is, approximately how many lobes are present in each breast? Once again, approximately how many lobes are present in each breast? ইচ ব্রেস্ট বলতে এক একটা ব্রেস্টে মানে একটা ব্রেস্টে কতগুলি লোবস থাকে। অপশন এ 5 to 10, অপশন বি 10 to 15, অপশন সি 15 to 20 and option D 20 to 25. And the correct answer is 15 to 20. Approximately 15 to 20 lobes are present in each breast. And the next important question is, at what week of gestation breast tissue begins to develop in a fetus? Once again, at what week of gestation breast tissue begins to develop in a fetus? Option A, 4 weeks. Option B, 8 weeks. Option C, 10 weeks. And option D, 12 weeks. And the correct answer is option A, 4 weeks. 4 weeks of gestation, breast tissue begin to develop in the fetus. And the next important question is, ovulation in the female with a 36-day cycle occurs between, once again, ovulation in a female with a 36-day cycle occurs between option A 30 to 34 day, option B 14 to 18 day, option C 8 to 12 day and option D 20 to 24 day. And the correct answer is option D, 20 to 24 day. Ovulation in a female with a 36-day cycle occurs between 20 to 24 day. And the next important question is, the ovarian cycle is initiated by. The ovarian cycle is initiated by option A, progesterone, option B, follicle stimulating hormone, option C, endorphins, option D, estrogen. And the correct answer is option B, follicle stimulating hormone. And the next important question is, the onset of menstruation is called. Once again, the onset of menstruation is called. Option A, menopause. Option B, menarche. Option C, andropause. And option D, ovarian cycle. And the correct answer is option B, menarche. The onset of menstruation is called menarche. And the next important question is, labor takes place dash day of the last menstrual period. Once again, labor takes place after dash day of last menstrual period. Option A, 260 days. Option B, 270 days. Option C, 250 days. And option D, 280 days. And the correct option is option D, 280 days. Labor takes place after 280 days of last menstrual period. And the next important question is, implantation of fertilized egg ideally occurs during dash phase of menstrual cycle. Once again, implantation of fertilized egg ideally occurs during the dash phase of menstrual cycle. Option A, secretory phase. Option B, menstrual phase. Option C, proliferative phase. And option D, ovulation phase. And the correct answer is secretory phase. Implantation of fertilized egg ideally occurs during the secretory phase of menstrual cycle. তো আজকের ভিডিও এইটুকু। আরও আমি কিছু ইম্পর্টেন্ট কোশ্চেন নিয়ে আলোচনা করব, যেগুলো আমাদের স্টাফ নার্স গ্রেড 2 এর জন্য খুবই ইম্পর্টেন্ট। আর কোন টপিকের ব্যাপারে বা কোন টপিকের কোশ্চেন নিয়ে আলোচনা করব, তো অবশ্যই আমাকে কমেন্ট বক্সে জানাবে। আমি আমার সর্বটুকু দিয়ে চেষ্টা করব সেই টপিকের ওপরে কোশ্চেনগুলো নিয়ে আসার বা কোশ্চেনগুলো নিয়ে আলোচনা করার। তো আজকের ভিডিও এইটুকু। দেখা হচ্ছে আমার নেক্সট ভিডিওতে।